question. Good afternoon, friends. Hope you are preparing well. Today we are going to a few MCQs as well as the relevant theory of the relevant questions. Since MCQs is what which is going to come in the examination, we have to be thorough solving the MCQs, and this is the time we are approaching near to examination. The more MCQs you practice, the more is your chances of getting a good rank. So if you practice the MCQs properly, you will be able to rank easily or naturally and automatically. So let us begin with the first question. A lady developed chickenpox during pregnancy. See, chickenpox is very important. This can be asked in medicine, it can be asked in microbiology, it can be it is the most important topic of pediatrics. So one or two questions on chickenpox, maybe a question on vaccine may come. So that is why this question is so important. So a lady develops chickenpox during pregnancy. Highest risk of transmission to fetus is at which period of gestation? So what do you think can be the options? So let us look at the options. A. 8 to 12 weeks, B. 14 to 18 weeks, C. 34 to 37 weeks, and D. 28 to 32 weeks. So the options are A. 8 to 12 weeks, B. 14 to 18 weeks, C. 34 to 37 weeks, and D. 28 to 32 weeks. Now some facts regarding the chickenpox before we solve this question. The important fact regarding chickenpox is that the congenital varicella syndrome, usually when the fetus gets infected in the of before 13 weeks, the chances is 0.4%, and after 13 to 20 weeks the chances are 2%, and after 20 weeks it becomes almost rare if the fetus, if any, gets infected. So congenital varicella syndrome occurs before 13 weeks and between 13 to 22 weeks. Before 13 weeks the chances are 0.4%. Between 13 to 20 weeks the chances are 2%. So the highest chance is between 13 to 20 weeks. In the options it is given as 14 to 18 weeks. So the nearest option to the answer is 14 to 18 weeks. So let us look at the correct option now. Let us look at the correct option now. So the correct option is B, 14 to 18 weeks. Correct option is B, 14 to 18 weeks. Let us move to the next question. A patient presented with external joint, that is metacarpophalangeal joint, and flexion of IP joint, that is interphalangeal joint. Which muscle is affected? See, the hand, the wrist and the legs are very important point from the MCQ point of view. So question can be asked from this. See, The extension of MCP joint and flexion of IP joint is due to palsy of lumbricals and interossei. So now let us look at the options. A. Interossei and lumbricals. B. Extensor digitorum. C. Abductor pollicis longus. And D. Abductor pollicis brevis. So the correct option is A. Interossei and lumbricals. Now let us move to the next question. Ligation of common hepatic artery. Remember, one question will be on blood supply, and especially the blood supply of the stomach. So ligation of and the celiac trunk, these are important aspects. Abdominal aorta, celiac trunk, all these are important. Ligation of common hepatic artery will impair the blood supply in. Now let us look. The right gastric artery, always remember, it is a small artery that arises from the common hepatic artery. Similarly, the right gastroepiploic artery arises from the gastroduodenal artery. Again, this gastroduodenal artery is a branch of common hepatic artery. So let us look into the options. Right gastric artery and left gastric artery. Right gastric artery and gastroepiploic artery. Right gastric artery and right gastroepiploic artery. Right gastroepiploic artery and short gastric vessels. Then right gastric and short gastric vessels. So the correct option is, let us look which is the correct option. It appears to be right gastric and right gastroepiploic artery. So let us confirm it. So the correct answer is right B, right gastric artery and right gastroepiploic artery. So ligation of common hepatic artery will impair blood supply in the right gastric and right gastroepiploic artery. Drug acting via tyrosine kinase receptor. So drug mechanism of action and drug receptor mechanism is what mostly asked in the postgraduate entrance examinations. So let us look at the options. A. TRH, B. TSH, C. Insulin, D. MSH. So TRH, TSH and MSH are linked to GPCR. Insulin is a tyrosine kinase receptor. So the correct answer is C. Now the other tyrosine kinase receptors are insulin growth factor 1 and various other growth factors such as epithelial growth factor, vascular endothelial growth factor and platelet derived growth factor. So the drug acting via tyrosine kinase receptor is insulin. So the correct answer is C. If the percentage of thymine residues in DNA is 28, what is the percentage of cytosine? If the percentage of thymine residues in DNA is 28%, what is the percentage of cytosine? Now let me tell you, you must be knowing about it, the Chargaff's rule. What does the Chargaff's rule say? The Chargaff's rule says that in DNA molecule the concentration of DNA equals that of thymidine. So A is equal to T and G equals C. So A is equal to T, G is equal to C. Now we know the formula A plus T plus G plus C is equal to 100%. Now we can write it as 2T plus 2C is equal to 100%. T is given as 28. So 2 into 28 is equal to 2C is equal to 100%. So that is 2C is equal to 100 minus 56, that comes to 44. So 2C is equal to 44. So C is equal to 22. So the percentage of C is 22%. Now let us look at the options. A. 28%. B 44% has been given to confuse you. C 36%. And D is 22%. Since we have already arrived at the answer, it is 22%. Now let us confirm it. So the correct option is D, 22%. The answer B is just to confuse you, 44%. If you don't pay attention, you will mark it as B. In fact, the real answer is D, 22%. Careful. A patient complains of knee pain. Okay, knee pain. Routine investigation are unremarkable and still the patient is unsatisfied. The urine turns black on standing. Knee pain is there. Urine turns black on standing. Which of the following enzyme is involved? Now let us look at the options. A. Homogentisate oxidase. B. Xanthine oxidase. C. Phenylalanine hydroxylase. Phenylalanine hydroxylase. And D. Dihydroorotate. Now this is a clear-cut clinical case of alkaptonuria. So what are the clinical features in alkaptonuria? The urine darkens on standing. There will be arthritis, pigmentation of sclera and ear, pigmentation of heart valve, larynx and tympanic membrane, darkening of concha, anthelix and helix. So the clinical scenario depicts it as a case of alkaptonuria. So alkaptonuria. So the correct answer is A. Homogentisate oxidase. Why homogentisate oxidase? I will tell you. Then why not phenylalanine hydroxylase? In phenylalanine hydroxylase, there is a mousy odor urine and hypopigmentation. The deficit is it causes phenylketonuria. Xanthine oxidase. Xanthine oxidase again. Xanthine oxidase, then dihydroorotate dehydrogenase. So the correct answer is A. Homogentisate oxidase. Let us confirm the answer. The answer is A. So a patient complains of knee pain, routine investigations are unremarkable and still the patient is unsatisfied. Urine turns black on standing. Which of the following enzyme is involved? The correct answer is homogentisate oxidase, that is A. A female is on Mage as a staple date. Now, Mage as a staple date. When you hear about Mage as a staple diet, what comes into your mind? Which deficiency disorder comes into your mind? It is due to deficiency of, let us look at the options. A. Zinc. B. Niacin. C. Thiamine. D. Riboflavin. Now what happens in riboflavin deficiency? In riboflavin deficiency there is which is called ariboflavinosis. There occurs glossitis. There occurs glossitis. There occurs glossitis. And what happens in pellagra? That is niacin deficiency. In which conditions niacin deficiency occurs? Niacin deficiency occurs in Mage eaters. Okay. Then carcinoid syndrome and then Hartnupp's disease. Riboflavin deficiency produces riboflavinosis, corneal opacity, dermatitis. Then thiamine deficiency causes wet beriberi and dry beriberi. So the correct option is B, niacin. So let us look, confirm it. A female is on Mage on staple diet, history of diarrhea, lesion in neck region. It is due to deficiency of B, niacin. Graft used from an identical twin is called. Now let us look into the definitions of different grafts. So autograft. What is autograft? Tissue that is transplanted from one site to another on the same patient. Then isograft. Isograft means transplant from a genetically identical donor such as an identical twin. Then homograft. Homograft means the transplant of individual of the same species. Then heterograft. Heterograft means transplantation from other species. Now let us look into the options. A. Homograft. Homograft means transplant from individual of same species. Transplant from a transplant from one site to another site on the same patient. Then isograft. Isograft is transplant from a genetically identical donor such as an identical twin. Then homograft. Heterograft. Heterograft is transplant from another species. So the correct option here appears to be isograft. Let us look. Graft used from identical twin is called isograft. The correct option is C. Effacement of food process is pathognomic of which disease? Of food process is pathognomic of which disease? Now, in which condition this effacement is seen? Effacement. Do you know about minimal change disease? What happens in minimal change disease? The histopathology is normal, but electron microscopy shows loss or effacement of food process. This word you have to remember very clearly. Whenever this word comes, the answer is immediately minimal change disease. Now, let us look into other options. A. Membranous glomerulonephritis. B. Minimal change disease. C. IgA nephropathy. D. Diabetic nephropathy. What happens in diabetic nephropathy? In diabetic nephropathy, there are glomerular lesions. Glomerular lesions. The most are capillary basement membrane thickening. Glomerular lesions, capillary basement membrane thickening. Diffuse mesangial sclerosis. Diffuse mesangial sclerosis and nodular glomerular sclerosis. Diffuse mesangial sclerosis and nodular glomerular sclerosis. So, the correct answer is B. Minimal change disease. Anti-glaucoma drug that acts outflow is anti-glaucoma drug. So let us look into the options. A. Latanoprost. B. Timolol. C. Pilocarpine and D. Dorzolamide. Now let us look into the options each one by one. Dorzolamide is carbonic anhydrase inhibitor. It reduces aqueous production. Then Timolol. Timolol is a beta blocker that acts by decreasing spontaneous production. Pilocarpine. Pilocarpine is a meiotic agent that increases the trabecular outflow. So the correct option here appears to be latanoprost. Let us confirm our answer. The correct option is A, that is latanoprost. This was all today, but I will be coming doing live classes till you people get selected. So please like, share and subscribe this channel, and please click in the link in the description box to attend the other classes, free classes and guidance, the much needed guidance to make you successful in NEET PG 2023. I wish you all the best.